would like to tell you about our profession. We are EMTs and paramedics. We respond to emergencies when you or someone you know is feeling sick, needs help, or is injured. Remember, you're only supposed to call 911 when there is an emergency or you need help.
So today we're going to go over what it's like being an EMT and what we do for patients, and today's specific example would be what we would do if the patient was having a stroke. Hi ma'am, my name's Twee. I'm with the ambulance and this is my partner Mike. Can you tell me what's going on today?
I feel weird.
Okay, can you tell me what you mean by weird?
Like I kind of feel like loose right now.
Okay. So one of the common signs that we see with a stroke is that the patient will feel weak, they might have numbness or tingling, or they might not really recognize one side of their body. So what we would usually do is we would do something called a FAST exam. F stands for face, so we look for facial droopness. A is for arm, we're looking for any arm drift. S is for speech, so if they have weird slurred speech. And then T is for time, so the onset of when they started having these symptoms or when they started acting weird. So can I have you smile for me? Okay, can you try to show me your teeth, please? All right, as we can see here, her smile's not normal. One side is lower than the other. I'm gonna have you hold out your arms for me. Hold them like a pizza box. Go ahead and close your eyes. And as you can see here, we see one arm is weaker. We're seeing some drifting. And can you tell me the sky is always blue?
Sky is always true.
And then that's where our weird, funny speech comes in. So all these things that we see here, we would consider as a stroke. Some of the things that can mimic a stroke is having low blood sugar. So we always take a blood sugar.
All right, man, can I see your finger real quick? Just gonna get a blood sugar from you, all right?
So when we show up, we're here to help. Some of the things, we use needles or we have stickers. Some of it may seem scary. It's a very difficult situation for a patient, especially a stroke patient, because sometimes they're confused, they don't know what's going on. But we like to remind them that we're here to help them and to not be afraid of us.
So blood sugar is 95, so that's normal.
Okay. And the next step that we would do is we would check out our heart. So here's our heart monitor. It can do a lot of things, but today we're just going to take a look at the electrical activity of her heart. So on the way to the hospital, I still continue to monitor her vitals, her heart, her blood pressure, and how well her oxygen is moving. I'll continue to reassess her, so look at her again to see if her stroke has changed in any way. I also started an IV in case she needs any medication in the hospital. And my partner is up front driving us to the hospital. In order to let the hospital know, I can call them by the radio or I can call them on the phone to let them know how far we are away and what's going on with my patient. St. Francis from AMT Paramedic 24.
Thanks for taking the time to learn what it's like to be an EMT or paramedic.
Bye guys!